Our lesson for today is about, for Pharma 2, it's about complementary and alternative medicine. So, complementary medicine is goes together with conventional medicine. Example of which would be your anxiolytics and massage therapy for anxiety. The alternative medicines would be these are the type of medicines that are made in place of conventional medicine. The approach is holistic. It focuses on treating the whole body and mind. Here is the 10 most common complementary alternative medicine therapies among US adults, and with it will be the examples and their respective percentage. Like majority of American adults uses natural products at around 18%. They exercise deep breathing around 13%, and 9% does meditation. 9% goes to chiropractic and other uh, osteopathic therapies. 8% prefers massage. 6% does yoga or do yoga. And 4% are involved with diet therapies. 3% has progressive relaxation. Around 2% usually do guided imagery, and around 2% practices homeopathic treatment. A survey done on Americans, around 38% of the adults uses some form of your complementary and alternative medicine. Distinct patterns of those who use your complementary and alternative medicines would include the following. These are the users, or are women, those who have higher education, or those who experience to be being hospitalized for the past year, those who are former smokers, those who have pains on their back, neck, head, and joint, and those suffering from gastrointestinal disorders or having sleep problems. These are the examples of your alternative medical systems. This includes your traditional medicine or your TCM, your Ayurveda or Ayurvedic medicine, and homeopathies. Your traditional Chinese medicine believes the basis on is the balance of qi or the body energy. It involves the use of acupuncture, herbal medicine, massage, and qigong. It's a type of uh, fluid exercise. Those who practice Ayurveda, okay, Ayurveda began 1,000 years ago in India, and it aims to restore harmony by questioning, observing, touching, and classifying patients. Homeopathy is an unconventional Western system based on the idea that like cures like. It employs herbal medicine, minerals, and chemicals in diluted forms to kill or ward off illnesses. Now let's talk about naturopathy. Naturopathy restores health rather than curing the disease. It involves diet, clinical nutrition, homeopathy, acupuncture, herbal medicine, hydrotherapy, manipulation, physical therapy, therapeutic counseling, and even pharmacology. And there's a degree that a person can undergo. You can have your naturopathic doctor or NDDT. So this naturopathy involves in restoring the balance of health rather than curing a certain type of illness. The National Center for Complementary Medicine and Alternative Medicine, or your NCCAM of the United States, has grouped the many varieties of CAM into four domains: the manipulative and body-based practices. The second will be your energy medicine. The third is your mind-body medicine. And the fourth is your biologically based practices. So here are the explanations, or what are the involvement of the four domains. The manipulative and body-based practices are based on manipulation of movement of one or more body parts. The energy medicine involves the use of energy fields like chakras, okay, yeah, such as magnetic fields or biofields, which are energy fields that some believe that surround and penetrate the human body. The body medicine uses a variety of techniques designed to enhance the mind's ability to affect bodily function and symptoms. This involves the mind over body principle. The biologically based practices use substances found in nature, such as herbs, special diets, or vitamins, in doses that are outside those used in conventional medicine. So they may use mega doses. So the whole medical systems are built upon complete systems of theory and practice. Often, these systems have evolved apart from and earlier than the conventional medical approach used the Western society. So this is a table that shows the example of the different complementary alternative medicines. Okay, your alternative medical systems like your Ayurveda, Chinese, Native American, Aboriginal, African, Middle Eastern, Tibetan, Central, Southern American cultures, homeopathy, and naturopathy. The mind and body interventions involves cognitive behavioral approaches, meditation, hypnosis, even dance, music, art therapy, prayer, and mental healing. The biological-based therapies involves dietary supplement, herbs, those orthomolecular uh, substances or medicine which uses varying concentrations of chemicals like magnesium. So you have your magnesium dip, the use of melatonin for mood stabilizing, and mega doses of vitamins like mega dose of your vitamin B and even your vitamin C. There will be individual biological therapies which the use of Lectril, even shark cartilages, and even bee pollen. So these are all based on biological-based therapies. How about your manipulative and body-based methods? It uses your chiropractic, osteopathic manipulation and massage, and energy therapies with Qigong, your Reiki, therapeutic touch, the use of bioelectromagnetic-based therapies like pulse field, magnetic field, or alternating current or direct current fields. So let's now focus on the much well-known CAM, which is your traditional Chinese medicine. The basis of the Chinese medicine will be based on the balance of the two forces, the yin and the yang. These are two abstract and complementary aspects that every phenomenon in the universe can be divided into two. That is the moon and the sun. So two opposites, the male and the female, inside and out, up and down, moist and dry. Insufficiency explains symptoms of disease. So if there is insufficiency, there will be a balance in these energies. So the yin vacuity, vacuity means the total absence of matter or its emptiness or insufficiency, will manifest as heat sensations, night sweats, insomnia, dry pharynx, dry mouth, dark urine, a red tongue with scant fur, and a fine and rapid pulse. While with the insufficiency or vacuity of yang will manifest as aversion to cold. So yin is for heat sensation, insufficiency will have heat sensation, but yang will have aversion to cold, cold limbs, bright white complexion, long voiding of clear urine, diarrhea, pale and enlarged tongue, and a slight weak, slow, and fine thoughts. Okay. So yin involves it's the cold and yang is the warm. So if there is uh, yin vacuity, it is more of the yang now, of the heat. And if there is insufficiency of the yang or the hot, there will be an excess of the yin or the cold. What are the physiological philosophical background would be your Wu Xing or the five phase elements. So we have watched in other movies and we have learned that there are five elements in the world. Would be your wood, the elements of wood, the elements of fire, earth, metal, and water. So let's talk of each elements based on direction. So let's talk about this table. So for direction, wood means it is towards the east, fire means it is towards the south, and earth will be on the center, metal will be on the west, and water will be on the north. For wood, okay, the color would be green or blue, the climate is wind, the taste will involve would be sour, the zang organ involved would be your liver and the gallbladder, and the sense organ will be the eye. For fire, the direction is towards the south, color is red, climate is heat, the taste is bitter. The zang organ would be your heart and small intestine, and the sense organ would be the tongue. For earth, the direction is towards the center, the color is yellow, climate is damp, taste is sweet. The zang organs will be your spleen and stomach, and the sense organ will be your mouth. For metal, the direction is towards the west, the color is white, it manifests the climate as dryness, the taste is acrid, the zang organs will be your lung and your large intestine, and the sense organ will be the nose. For water, the direction is towards the north, the color would be black, the climate would be cold, the taste would be salty, the zang organs involved are your kidney and bladder, and the sense organ will be your ears. So these are the uh, phenomena of the universe and nature, okay, that are broken down to five elements of the universe and nature. So let's talk about the model of the body, that is in respect to yin and yang, to the Chinese medicine. So that's what we call energy that flows through our body, and the Chinese call it your qi. That's your vital energy, your qi or qi. It circulates through channels like road maps. It's called your meridian. Okay, that branches to other organs and will have manifest and functions. Okay, the tendency of Chinese thought is to seek out the dynamic functional activity rather than to look for the fixed somatic structures that perform the activities. Because of this, the Chinese have no system of anatomy comparable to that of the West. That is according to Ted Kapchuk, the web that has no weaver. So for the Chinese medicine, the concept of disease would be Most of the disease entities listed constitute only symptoms. Therapy is not chosen according to the disease entity, but according to the pattern. So they are looking for disease patterns. Hence, no two people with the same disease entity, uh, but different patterns will receive different therapy. If you have the same cause, but if the disease pattern is different, you will be receiving different therapies. So with Chinese medicine, we also deal with excesses of energy of the elements. Like in the wind, the excesses of the wind will manifest as rapid onset of symptoms. There is wandering location or of symptoms with itching, nasal congestion, tremor, paralysis, and convulsions. So these are the symptoms of wind excesses. For cold excesses, there will be cold sensation, aversion to cold, relief of symptoms by warmth, the presence of watery clear excreta, severe abdominal pain, severe pain, contracture, hypertonicity of muscles, the white tongue or deep or hidden or string-like pulse or slow pulse. With excess of fire or heat, there will be aversion to heat, high fever, thirst, concentrated urine, red face, red tongue, yellow tongue, and with rapid pulse. For dampness excess, there will be sensation of heaviness, sensation of fullness, symptoms of spleen dysfunction, and the tongue will tend to be greasy, and there will be slippery. It is characterized, pulse will be characterized as slippery pulse. Excess of dryness would manifest as dry cough, dry mouth, dry throat, dry lips, nosebleeds, dry skin, and dry stools. For summer heat, either heat or mixed damp heat symptoms. Now, let's go to the more concrete examples of your Chinese medicine basing on the principles of yin and yang, basing on the principles of qi and the meridians, basing on the principles of excesses of the elements. So we now talk about the two practices. The common practices in Chinese would be your acupuncture and moxibustian. So qi was believed to flow on the body's primary organs to the superficial body tissues of the skin, muscle, tendon, bones, and joints through channels called your meridians. So there will be acupuncture points where needles are inserted and are mainly found at the locations along the meridians. So many acupuncturists attribute pain relief with the release of your endorphins. Okay, when needles penetrate the skin, so your endorphins are your peptide hormones that binds to opioid receptors and acts as neurotransmitters. So the effect of endorphins will be the reduction of sensation to pain and will affect emotion. The mechanical deformation of the skin by acupuncture needles will release adenosine. So what is an adenosine? Adenosine is a peptide also that has a role in regulating various physiological functions. Your acupuncture will have its effect on gastrointestinal disorders, which will relate to the parasympathetic and the sympathetic nervous system stimulation, uh, which the said to be the Western medicine, okay, and is equivalent to the yin and yang. the sympathetic and the parasympathetic. Of course, the promotion of gastric peristalsis in subjects with acupuncture with low initial gastric motility, later on suppressing peristalsis in subjects with active initial motility. Okay. So with acupuncture, they promote gastric peristalsis among subjects with low initial gastric motility, and they suppress peristalsis in subjects with active initial motility. Well, neuroimaging studies has been done for acupuncture, when acupuncture stimulation results in the activation of your limbic system and the default mode network. So there is the activation of these two areas, the limbic brain areas and the default mode network. And there's a meta-analysis that was done in 2012 that says that it studies the effect of acupuncture. And this study, this meta-analysis, uh, says that the mechanisms of acupuncture are clinically relevant, so it is effective. But an important part of this is the total. This total effect is not due. So this is not due to the location or the acupuncture points or the depths or the meridian, but are associated with the more potent placebo effect. So what is placebo? Placebo are substances that has positive effects as a result of a patient's perception that is beneficial rather than the result of a causative ingredient. In a 2012, another in a review in Cochrane literature review in 2011, it says that there is high evidence of regarding acupuncture, regarding the relief of pain, but it says that the conclusion was that acupuncture can be effective for some, but not all kinds of pain. Now, after acupuncture, now another type of your Chinese medicine would be the use of cups or ventosa. So this is a type of Chinese massage which involves placing several cups on the body, and we use cups and a match slip inside the cup, and then it is removed before placing the cup against the skin, and the resulting air in the cup will be heated and it expands, and after placing in the skin, it cools down, creating a lower pressure inside the cup that allows the cup to stick to the skin via the suction. So it will create a lower or negative pressure so that there will be suctioning. Okay? Okay. However, the cupping or ventosa, as to researchers, they have not found, it has not been found to be effective for the treatment of any disease. Will be on a more on a placebo effect again. Those who experiences relief. Now let's talk about qigong. Qigong involves life energy cultivation. It involves a holistic system of coordinated body posture and movement. It involves breathing and meditation that is used for health, spirituality, and martial arts training. So, what are the possible health benefits in the practice of Qigong? So, they claim that it has a very good uh, effect on hypertension. So, because there are improved blood pressure, the practice of Qigong improve blood pressure compared to doing nothing. But it was found that it was not superior to the standard treatment such as medications or conventional exercise. So how about the effect of Qigong among diabetics? Evidences are insufficient to suggest that Qigong is an effective treatment for type 2 diabetes. So it would be diet, exercise, and medication. How about on pain management? There are evidences that says Qigong is effective for pain management, but the evidences for this effectiveness will warrant further studies due to the small number of studies and participants involved, which can preclude any firm conclusion about the scientific effect of Qigong on pain. Now, let's talk about the well-known massage. So we have a lot of massage that are cropping up and popping out everywhere. So let's talk about massage. So there are different types of massage. One would be your Ayurvedic massage. So your Ayurvedic massage involves the stimulation of your lymphatic system, making it expel toxins out the body. It also because it can also involve the production of lymphocytes and can result to pain relief, reduction of fatigue, prevention of aging, and restoring longevity. Now, another one though, so we have a lot of these would be they offer it a Swedish or your classic massage. So your Swedish or classic massage will involve 5 strokes, namely your effleurage, meaning the sliding or gliding. The kneading would be your petrissage. The ones that involve rhythmic tapping would be your tapotement, the cross fiber or with the fibers, the friction, and the shaking or vibration. So with the Swedish or classic massage, it is helpful in reducing pain, joint stiffness, and improving function of the patient with osteoarthritis of the knee over a period of 8 weeks. And it has been said that it is very effective in reducing low back pain, and the effectivity can last as long as 15 weeks. Okay, something to pick up. Now, another one that usually are very frequent, or many of this type of massage are popping out in our community, would be your Thai massage. Thai massage is also known as your Thai yoga massage. This is a traditional healing system combining acupressure, Indian Ayurvedic principles, and assisted yoga posture. So this will be a deep, full body massage, progressing from the feet up. So it levels up from the feet going to the head, and it focuses on the energy lines throughout the body or the meridians with the aim of clearing the blockages among these lines. So this is the principle of acupressure, and it also stimulates the blood flow of blood and lymph throughout the body. So that is your Thai massage. How about reflexology? So in reflexology, the feet has been mapped out. The soles of the feet has been mapped out, and that will represent the different organs in the body. The median will be the median organs, is your heart, okay, your lungs, okay. And reflexology will involve the gentle manipulation or pressing on the certain parts of the foot to produce an effect elsewhere in the body as to the organs that these are represented in the soles. However, there's a 2009 systematic review, so it's now 10 years ago, of RCTs, randomized controlled trial, And this systematic review uh, found that the best evidence available to date does not demonstrate that reflexology is a treatment for any medical condition. So maybe massaging the foot can increase now endorphins. You might feel relaxed, but still, based on science, based on a systematic review of your different RCTs, it says that reflexology is not an effective treatment for any medical condition. Next would be your mindfulness meditation. So these are not quite new, but it is more of uh, 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 it is more encouraged now to practice mindfulness meditations. Okay. Mindfulness meditation in a 2014 study says that it reduces anxiety, depression, and pain because practicing it, we become aware what is currently happening. So what is now around the practitioner as opposed to focusing on something different than the present. So mindfulness is just feeling and being aware of now, of yourself at the moment of your surroundings. In effect, the practice of it would let go of mental attachment and worry. So I think it's very good for mental relaxation. Okay. Now, let's proceed to the manipulative and body-based practices. Okay, so we have different manipulative body-based practices like your chiropractic medicine. So we have some clinics now here in the Philippines. Okay, so the practice of chiropractic medicine is the diagnosis and treatment of mechanical disorders of the musculoskeletal system, especially those that involve the spine. And it involves spinal manipulation with passive maneuver during which a joint complex is taken past the normal range of movements. Okay, so it's past the normal range of movements, but not so far that it has to dislocate or damage the joint. Okay. So massage therapy. These are soft tissue manipulation by trained therapists. So the word here is trained therapists for healing purposes for low back pain, overworked muscles, reduces stress and anxiety, rehabilitating sports injuries, and promoting general health. Now let's proceed on the discussion on the medicine that involves energy around the body. So it's the chakras. So there are 7 energy chakras or energy uh, focus. Okay, so this focuses on either on energy fields throughout thought to originate within the body or the biofields, or on fields from other sources, your electromagnetic fields. So your energy medicine involves your biofields, your qigong, your reiki, and therapeutic touch. Discuss each one. Okay. Um, also, we do practice biologically based practices like the use of herbal medicine. Okay. People has been using herbal remedies for thousands of years, but it's not because something is natural, however, does not necessarily mean it is safe. So herbal medicines are not to be taken lightly. So you better study well what will be the effect and the side effect and the reaction of such herbal medicines. Okay. The use of special supplements. Okay. Not all supplements in the market are from plant. So example of those non-plant based would be your omega-3 coming from salmon. Okay. oil or otherwise coming from cod liver oil. Okay. So there are increasing reports in the media of the health benefits of various vitamins, minerals, and amino acids and other specific biological compounds. So the role of functional foods in your complementary and alternative medicine therapies could be divided into functional foods, which are foods or supplements which are designed to improve some specific aspect of physical or mental functioning. And your nutraceuticals, this is now an evolving and improving aspect of medicine. It involves combined nutritional and pharmaceutical benefit using food, okay, and herbs. Yeah. So, with this in mind, with this different complementary and alternative medicine, the use of many supplements, how do we protect our patients or us, the consumer? First, talk to your doctor, talk to us, talk to the ones who cares, take time to study such uh, complementary type of treatment. Of course, do your research. Now it's very easy. Now it's very easy now to do your homework. Do search now. It's Google is the education is now in your fingertip. Just be remind your patients that go to reputable sites like your NIH or other medical institutions that has pages for lay people, and also advocate for a more stringent FDA approval, and your consumer should help for the USP dietary supplement verified seal. Okay, so that's how we protect our consumer. So this is a diagram that differentiates the different complementary and alternative medicines to four quadrants, differentiating them as to level of safety and effectivity. So on the upper part will be your more safe, the lower part will be your less safe, the left side will be your less effective, and the right side will be your most effective. So let's talk about the more safe and more effective. Okay, likely safe and effective. This would be your chiropractic care for acute low back pain, acupuncture for nausea from chemotherapy, acupuncture for dental pain, mind-body techniques for chronic pain and insomnia. But still, we advise that treatment is reasonable, but physician monitoring is advised. And what is the least effective and dangerous would be your injection of unapproved substances. The use of toxic herbs may cause liver damage here, can have your hepatorenal dysfunction and shock. Okay, taking of herbs known to interact dangerously with conventional medication like your St. John's wort and with your indinavir. So we advise avoid such mode of treatment. So there would be less effective but more safe is the use of acupuncture for chronic pain, homeopathy for seasonal allergies, low-fat diet for some cancers, massage therapy for low back pain, mind-body techniques for cancer. So we just advise monitoring and recommendation. More effective and less safe would be the use of St. John's wort for depression, so palmito for prostatic enlargement, chondroitin sulfate for osteoarthritis. So you know this one, these two are now widely advertised and used. Okay? Of course, there are supplements, such as palmito and chondroitin sulfate. The use of ginkgo biloba for improving cognitive function in dementia. So we advise decision monitoring it is important. So these are more effective but less safe. So, maraming salamat po. In spite of the dogs barking, I say thank you. And if you can find this lecture, I've uploaded it in my YouTube channel. Just look for Benjamin Cabrera, and this is my icon. You click subscribe, click the thumbs up, and click your notification button. Again, for the next lecture, let's wait for it.